There is no question in my mind that vitamin C is truly as close to a panacea, a cure-all that we have today. In fact, almost every health problem will respond to treatment and recover better when patients are receiving adequate levels of vitamin C. I am certainly not alone in this statement, as one of the greatest scientists, two-time Nobel laureate winner Linus Pauling, devoted his second half of his career to the study of vitamin C. Dr. Fred Klenner, MD, went deep into the archives of studying vitamin C. Dr. Thomas Levy, MD, pointed out 1,200 scientific references of vitamin C and how effective it is in treating all our diseases. Nick Lane, a revered biochemist, went into the deep undertakings of vitamin C. We typically think of vitamin C as an antioxidant, for which it is. However, most of the function of vitamin C acts as a pro-oxidant, so virtually all the physiological actions of vitamin C are ping-ponging the electrons to either iron or copper, for which either those two metals will donate its electrons to activate oxygen. Vitamin C is needed for a wide range of biochemical reactions to help maintain normal physiological function. One of the best known requirements for vitamin C acts as a cofactor in producing collagen synthesis. Collagen fibers are so important for structural and shock-absorbing components of connective tissues, including bone, teeth, cartilage, ligaments, skin, and blood vessels. So in the absence of vitamin C or in the absence of copper, collagen synthesis will become compromised. Now, collagen can only be synthesized in the presence of molecular oxygen. Vitamin C acts as an electron donor to copper so that copper can send the electron to oxygen, in which the oxygen binds to a hydrogen, creating a hydroxyl group that will attach to the 3 amino acids, causing the cross-linking of these 3 amino acids to make your connective tissue strong, flexible, and durable so it doesn't rip on a dime. Vitamin C also has neural and endocrine function, which is absolutely crucial to our physiological, psychological function. When we need to make adrenaline, we must have copper and vitamin C to convert the dopamine to adrenaline. We also need vitamin C and the copper for PAM. PAM, mostly found in the pituitary, basically activates immature peptide hormones and neurotransmitters. So without PAM, our hormones remain inert. Another huge player of vitamin C in the making of carnitine. So vitamin C will donate its electrons to iron to make carnitine. Carnitine is absolutely responsible for taking fatty acids to shuttle it into the mitochondria to make energy. Also, for the absorption of iron, we need vitamin C to move its electrons to copper, so copper can help churn the ferric, the Fe3, into the soluble form, ferrous iron, Fe2, so we can absorb it in our intestines. So without adequate supplies of vitamin C and copper, we can't absorb enough iron to make our red blood cells, our hemoglobin, and then hence we develop anemia. To reiterate, we see that vitamin C is a cofactor for at least 8 enzymes which affect completely different aspects of the body, from just general housekeeping tasks such as making collagen, to fat metabolism, to survival measures when we are under stress and we need adrenaline, also for the perception of pain to activate substance P. And in fact, we see how vitamin C is so important in our physiological properties that it makes this little nutrient a superhero.